celebrate such a gift to our community. We have received our first batch of COVID vaccine for Summit County. We are so thrilled and excited to be able to witness our first hospital staff being vaccinated today. It's really important to understand what a defining moment this is for our community. It really signifies the beginning of the end. And we're so thrilled to talk to you a lot about the vaccine today, the safety of the vaccine, how well it has been researched to be effective. What's most important too is that we are receiving this gift here during the holiday seasons. And what's also important to know is that we have a long way to go still. We know that masks, physical distancing, avoiding gatherings are things that are continue to be really important through the phases of distribution of this vaccine. That's what will get us to level orange and hopefully level yellow in the coming months. We know that the vaccine impact of vaccinations, we will not be able to have or see an impact of the vaccinations until early April probably. So we really need to keep up these practices and follow the 6 commitments that we know are working for our community throughout the holidays and for the next few months before we're going to be able to have some of these restrictions relaxed for us. So I think it's really important for our community to give that gift back to our community by following these 6 commitments during this holiday season. We know that last week COVID was the #1 cause of death here in Colorado, and across the nation we've surpassed over 300,000 deaths, so we need to continue to prevent these from happening, but we also don't want to take away from the celebration that we are feeling today in our community with all of our partners to be able to start this very monumental time in this pandemic. So Sarah's going to talk a little bit about the vaccine and how it was developed and its safety.
Thank you, Amy. Yeah, we are really celebrating this remarkable day, and we are going to be, as Amy said, witnessing the first vaccination, COVID vaccine, offering that protection to our friends and colleagues here at St. Anthony Summit Medical Center. You've probably been seeing across the nation these vaccinations happening, and it's a celebration for us locally and in the state and in this country. So very defining moment in this pandemic. And what is very challenging in the pandemic response is that we haven't had this valuable tool. And vaccines save lives, and vaccinations save lives. So we're receiving the vaccine, and access to those that have most risk of exposure to the virus is really critical at this time. So we're going to be rolling the vaccine out in phases, starting with our friends and colleagues here in the inpatient healthcare setting and the ERs here locally, and then moving down to allow vaccination to those who are next at risk. The vaccines that are available and are given today is the Pfizer vaccine. It's an mRNA vaccine, and essentially it's a messenger. It's designed to deliver a piece of genetic material to our cells, and it's asking our body to make a piece of that spike protein that is on that coronavirus, and then our body can make antibodies to that. So it's important to know that mRNA does not interact at all with our genetic material. It doesn't go into the nucleus of the cell. And then soon after, that messenger RNA delivers the message to and the instructions to deliver this protein. It rapidly disintegrates in the body. So this vaccine, it's remarkable in its safety and efficacy of around 95%. And so it's just going to be a phenomenal tool in our response to this pandemic. And we're extremely excited to be able to have it here locally, and we are very much in anticipation of the Moderna vaccine. It's the other mRNA vaccine that's been in development. It will have the regulatory meeting with the FDA today, and then the American Council on Immunization Practices will be doing emergency meetings thereafter to vote. So all of these vaccines are held to a very high degree of scientific research and study, and very large clinical groups, and just remarkable in the outcome of these studies. So we are very fortunate that we're here where we are on this day in this pandemic.
Hi there, I'm County Commissioner Elisabeth Lawrence, and I'm here at St. Anthony Summit Medical Center in Frisco on a very exciting and historic day, December 17th. It is the day of the first COVID-19 vaccines in Summit County. I'm here with Ruth, who's an employee at Summit Medical Center. And Ruth, tell us, what's your job here?
I'm an emergency room nurse here.
She's an ER nurse. Okay, so I've probably seen you a couple of times or two. But Ruth was actually the first person in Summit County to receive the coronavirus vaccine. And we're here with her. And so tell us, you just got the vaccine a few minutes ago. How did it feel?
It felt exactly like every other vaccine. It was easy. All you have to do is stand up straight.
Okay.
And easy peasy.
Okay, so right or left arm?
Right or left, here it is.
Okay, here, left arm, and look at those muscles. Okay, great. So left arm, so you've got the vaccine, you're an ER nurse, and did you have any, say, concerns about the vaccine going into this? Or tell me, were you nervous? What were you thinking about leading up to it?
I think I have the same concerns as probably the general public. What are the side effects? How effective is this vaccine? What does this look like in the long run? But after reviewing some really good research, this vaccine has a 94.8 efficacy, according to the latest study, of over 43,000 people. So I'm pretty comfortable with that information.
Oh, that's great. Wonderful. And so we know it's safe and it's very effective from trials we've seen so far. So what would you want people to know out in the public about getting it? Of course, we're prioritizing healthcare workers like yourself, and we're so grateful for the job that you guys are doing. And we have to keep you safe in order to keep our community safe. But as the vaccine is available to other people, what would you tell them?
Yeah, so I would encourage anybody that's over the age of 16 and non-pregnant women and anyone that's not immunocompromised, I would encourage them to receive this vaccine if they are willing and able.
Okay, great. Did they give you a sticker for getting the vaccine?
Just a Band-Aid.
Oh, just a Band-Aid. Okay. Well, next time we'll have some Summit County government stickers. Well, Ruth, we're very excited. You made history here in Summit County. Thank you for being so willing. We're grateful for what you're doing for our community, and thanks so much.
Thank you. It is a privilege to receive this vaccine and be the first one.
Great. Thanks, y'all. Stay safe.